So, just another big issue, we touched on it a little bit earlier, and that disability cases. Some employers have occupational, like a workers' comp type situation, but they also do non-occupational injuries where they'll have a company manage the person back to care. Some of these short-term disability cases, it goes from weeks or a month into months or sometimes longer, are the scary ones for the employers and for the individuals themselves. Does virtual care play a role for these long-term disability patients? And is it a cost savings? Like, how do you see it being relevant?
I see it as being very relevant. I think everybody's goal is to have a healthy employee not in pain and productive at work. I think the employee, the employer, benefits world, we can all agree that that's what we want. And there's a lot of different ways to get there. I think the landscape right now has made it harder and more prohibitive for certain classes of employees to achieve that on their own with the cookie cutter plans that are out there. So we talked a little bit about it before, where compliance is an issue, and when you add financial stress to a physical injury, having the choice of, well, do I comply with my program? Do I continue to go see a practitioner once I've run out of coverage?
Yeah.
Can I afford to do this? We don't want a disabled employee who's maybe disabled for the first time, doesn't understand the process, scared for the future.
Probably quite frustrated too.
Dealing with all sorts of forms, being tossed around by insurance companies, getting letters and legalese. And now we're saying, well, now you're out of pocket to get better. And so if we can help solve the choice that is heavily dependent on someone's ability to pay, well, why wouldn't we provide that solution to employees who need it most?
And really combine that human compassion, I think, with new data that allows us to make sure that the employees that are trying to get better are getting better, they have access to the best people. And the challenge in a lot of cases, or a good case for virtual care, is if the best healthcare professional is 200 kilometers away, well, it'd be great to be able to connect that employee with that provider.
Yeah.
And it'd be great to say if this employees doing their therapeutic exercises or their therapy, that we've got line of sight to the compliance or the adherence with that as well, so that malingering doesn't become an issue, because it is a big cost point when it does happen.
Yeah, absolutely. Yeah, the remote point is huge. If you don't have a therapist close by, you can bank that it's not going to happen.
Well, awesome. Thanks so much for making the time, Gavin. You've been one of those guys that are always looking at what's next in the industry and kind of coming up with new products and really leading that as an independent. So kudos to you.
Well, thank you very much. I was very happy to be here.
Okay.